Hello and welcome to Chesapeake Regional Emergency Department's Behavioral Health Unit. My name is Jennifer Morrison and I am the nurse manager, and I am very happy to be here today to take you on a tour of our long-awaited opening ED Behavioral Health Unit. So let's take a tour. So first stop, once you come into our beautiful brand new ED Behavioral Health Unit, is our Sallyport entrance, which is double secured. So for patient safety, we have the ability now to have a secured unit. And so you'll enter one door, and when we bring our patients in, we will then come in and we'll come into our dressing room here, and we will have the ability to get our patients, make sure that they are changed and safe, and we'll do all of our blood work and any work here, and then we will proceed to bring them on into our beautiful open pod. And as you enter, we now have the facilities to offer a shower. So we have a shower and a big restroom here. State of the art. And then we have our family room here where our family members will be able to come and visit with their family members who are staying with us. This could also be a consultation room or any kind of consults that need to happen. Our providers can see patients in here. And as we enter a little deeper, this is one of the first patient rooms we have here for our low acuity patients. It has a nice bed and a television, a nice soothing environment to have a lower exposure to volume and noises. Nice calming room. And then we have another restroom here. And as you walk into the nice open area here, it opens up to recliners, tables, chairs. We have a brand new television, and we have the ability for socialization, interactions. And then we also have 3 more patient rooms here for our low acuity. Major win for this environment for our behavioral health clientele is the fact that not only are they going to be able to have a nice area to move about and not be confined to one room, but they're also going to have the ability to interact with other patients and our ED behavioral health trained staff. We have nurses and techs who are behavioral health trained. They know how to do one-to-one therapies. They know how to hold group therapies. They know how to host social interaction that is beneficial for all, along with making sure that our patients are getting started back on medications as needed, while our behavioral health clinician team is working on finding them an inpatient route if that's what they need, or outpatient therapy pathway as well. We're kind of a dual location for that, seeing as how it's just a continuation of the emergency department for our behavioral health patients. We also have a room back over here that is what we are referring to as our consultation room, where we will be able to have our ED providers, our telepsychiatry, our behavioral health clinicians, our city partners through crisis will all be able to assess and talk with patients in a private environment. Our ED behavioral health techs or behavioral health nurses will be able to do intake or one-to-one sessions within this consultation room. And then right next door to it is our beautiful group room, where we offer more seating that is available, but we can also fold the tables if they wanted to do any kind of stretching, or we can host any kind of groups or activities in this room as well. We are going to be offering different therapeutic modalities for the behavioral health patients, for the nurses and techs to be able to offer different groups and therapy sessions to help aid in their recovery and maybe even make their inpatient stay just that much better. We also have our nursing station that is behind this glass here. It has been darkened for privacy, so my staff can see out, but nobody can see to the other side. That is my high acuity side. For those patients that are in crisis and need a little more help, we have really worked hard to ensure our behavioral health population have a very nice calming stay during their emergency department visit. So we've worked very hard for this for them because it's part of their healing and their therapy is to have a low stimulus environment, and this is definitely going to help with that. So if you take a walk with me this way, this is the entrance to the nurses station that is secured, and the nurses will be able to pass meds through that door. But if you head this way into our high acuity side, we have 4 rooms over here that have the ability to be a seclusion room, or if more help is needed, we do have the ability to secure them for their safety and provide medications to help calm them. Everything is very much so therapeutic and as last resort, but that is why we have this side if needed to help our patients stay safe. And thanks for taking this tour with me. I hope you enjoyed it as much as we've enjoyed building this and getting it ready for our community. And opening day is just around the corner. Thanks for joining me.